What is a normal pH in the body? A normal pH is 7.35 to 7.45. So the question stem will give you some kind of blood gas from the patient, and you have to determine is this consistent with acidosis or alkalosis. If acidosis is present or acidemia in the blood, this reflects a low pH. So the pH is going to be less than 7.35. Then we have to determine is this a metabolic acidosis or a respiratory acidosis. In the case of a metabolic acidosis, you're going to have low bicarb levels. In the case of respiratory acidosis, you're going to have high CO2 levels. There's going to be a future video that makes acid and bases easy, so stay tuned for that. So in the question stem, if they're asking you about anion gap metabolic acidosis, you're going to be given a low pH and a low bicarb level. Now that we know metabolic acidosis is present, we have to determine if the anion gap is normal or high. And the way you figure out an anion gap is you add up everything positive, including sodium and potassium, and then you add up everything negative, including bicarb and chloride. And then you're going to subtract the negative from the positive. A normal anion gap tends to be less than 12. I will say pay attention to your lab and the facility you work at because the normal anion gap range might be different. Some normal ranges only go up to 10 while others go up to 16. For the purposes of exams, if they're testing you on a high anion gap metabolic acidosis, then that anion gap is going to be obvious. It's going to be very high. The last thing to mention is when people use this practically, they don't always use potassium because it's fairly negligible. They take the total amount of sodium and then they subtract the total amount of chloride and bicarb levels, and then that's their anion gap. So now that we know a high anion gap metabolic acidosis is present, what's the mnemonic you can use to help remember the causes of this? Well, the mnemonic that people commonly use is MUDPILES. M stands for methanol, U will help you remember uremia, D stands for DKA, P stands for paraldehyde, I stands for iron or isoniazid, L stands for lactic acidosis, E stands for ethanol or ethylene glycol, and S stands for salicylate or aspirin. The final thing to mention is that sometimes people add cat to that, so it's cat MUDPILES, and this will help you remember 3 more things including carbon monoxide, aminoglycosides, and theophylline.